Here we will discuss about pharmacology of metformin, the gold standard in type 2 diabetes therapy. Classification and history from French dialect to modern medicine. Drug classification. The chemical class is buconide derivative dimethyl pharmacological class oral hypoglycemic agent insulin sensitizer. Historical context derived from Gallica officinalis and clinical status preferred first line agent for T2DM globally ADA and EAST. Unique property does not cause hypoglycemia and therapeutic dose euglycemic. Next we have mechanism of action and hepatic effects. Primary site of action is AMP activation. Activates AMP activated protein kinase and hepatocytes. Complex inhibition, mild inhibition of mitochondrial respiratory chain. Gluconeogenesis, massive reduction in hepatic glucose output, and the effect decreases fasting plasma glucose levels. And mechanism of action in peripheral and gut effects, skeletal muscle increases GLUT4 translocation to the cell membrane, enhancing insulin-mediated glucose uptake and utilization by muscle tissues. Intestinal impact slows glucose absorption from the gut and increases GLP-1 secretion. It also favorably alters the gut microbiome composition. Next, we have efficacy HB1 A1AC reduction metformin. It's about 1.5% reduction. DPP4 inhibitors, it's about 0.8% reduction. SGLT2 inhibitors, 0.9% reduction. Metformin remains the most potent oral agent for glucose lowering. Pharmacokinetics. Absorbed in small intestine via arginine transporter OCT1. Metabolism not metabolized, zero hepatic transformation. Distribution, negligible plasma protein binding distributes to and to liver and kidney. Elimination, 100% excretion change via renal tubular secretion. Then we have clinical applications, therapeutic indications, T 2DM, first line therapy for glycemic control, especially in overweight patients. Sorry. And PCOS off label used to improve ovulation and metabolic dysfunction and polycystic ovary syndrome and pre-diabetes prevention of T2DM progression in high risk individual with BMI more than 35. Serious safety concern, lactic acidosis, a rare but fatal metabolic emergency risk increases in acute renal failure, hypoxic stress, heart failure, and sepsis or dehydration. Then we have common adverse effects of metformin. In GI distress, it's almost 30% diarrhea, abdominal cramps, and nausea, dose dependent. And metallic test dysgeusia is common in initial weeks, and vitamin B12 deficiency. Long-term use interferes with absorption levels, and euglycemia does not cause hypoglycemia, very safe profile. Then we have adrenal cutoffs, contraindications. EGFR less than 30, it's about stop metformin immediately. And if EGFR is between 30 to 45, do not initiate. Reduce dose by 50% if already taking. And if EGFR is greater than 45, safe for all dosing with monitoring. And these are the mnemonic for metformin, M for metabolic liver focus, E for excreted unchanged, and T for T2DM first line, F for follow EGFR strictly, O for OCT1 transporter, R for rare lactic acidosis, and M for metallic test, I for insulin sensitizer, N for no hypoglycemia. So metformin, these are the mnemonics for metformin. If you have any question, you can ask in the comment section.